now call this meeting to order. So welcome everyone on this early morning for me. Welcome to meeting number 3 of the House of Commons Standing Committee on Health. The committee is meeting today to discuss committee business. Today's meeting is taking place in a hybrid format. I would like to start the meeting by providing you with some information following the motion that was adopted in the House on Wednesday, September 23rd, 2020. The committee is now sitting in a hybrid format, meaning the members can participate either in person or by video conference. All members, regardless of their method of participation, will be counted for the purposes of quorum. The committee's power to sit is, however, limited by the priority use of House resources, which is determined by the whips. All questions must be decided by a recorded vote unless the committee disposes of them with the unanimous consent or on division. And finally, the committee may deliberate in camera, providing that it takes into account the potential risks to confidentiality inherent to such deliberations with remote participants. The proceedings will be made available via the House of Commons website. And so you are aware, the webcast will always show the person speaking rather than the entirety of the committee. To ensure an orderly meeting, I would like to outline a few rules to follow. For those participating virtually, members and witnesses may speak in the official language of their choice. Interpretation services are available for this meeting. You have the choice at the bottom of your screen of either Floor, English, or French. Before speaking, click on the microphone icon to activate your own mic. And when you're done speaking, please put your mic on mute to minimize any interference. A reminder also that all comments by members and witnesses should be addressed through the chair. Should members need to request the floor outside of their designated time for questions, they should activate their mic and state that they have a point of order. If a member wishes to intervene on a point of order that has been raised by another member, they should use the raised hand function. This will signal to the chair your interest to speak and create a speakers list. In order to do so, you should click on the participants at the bottom of the screen, and when the list pops up, you'll see next to your name that you can click raise hand. When speaking, speak slowly and clearly. And unless there are exceptional circumstances, the use of headsets with a boom microphone is mandatory for everyone participating remotely. Should any technical challenges arise, please advise the chair or the clerk. And please note that we may need to suspend a few minutes by times as we need to ensure all members are able to participate fully. For those participating in person, proceed as you usually would when the whole committee is meeting in person in a committee room. Keep in mind the directives from the Board of Internal Economy regarding masking and health protocols. Should you wish to get my attention, signal me with a hand gesture or at an appropriate time, call out my name. Should you wish to raise a point of order, wait for the appropriate time and indicate to me clearly that you wish to raise a point of order. With regard to a speaking list, the committee clerk and I will do the best we can to maintain a consolidated order of speaking for all members, whether they're participating virtually or in person. And in order to be fair for all committee members, the list of speakers will only be activated once the meeting has officially started and not upon admission to the room. So having said that, let me just go to the
point of order,
panel.
Mr. Chair. Just, I guess we're switched out to Mr. Dalton. So if the clerks are looking for someone to dialing in, that Mr. Dalton will be replacing Ms. Rempel-Garner for a few moments.
Thank you, Mr. Dantemont. So on the participants list, I see we have Mr. Van Bynen. Mr. Van Bynen, please go ahead. You have the floor.
Thank you, Mr. Chair. Mr. Chair, let me call up my notes. Earlier this year, we had over 34 meetings of the Health Committee, and we heard 171 witnesses and received 51 informative briefs covering an array of issues, but only one out of the 34 meetings that we held over the spring and the summer focused on mental health. While it was enough to open our eyes, it was certainly not enough for us to get a better understanding of the urgency of the situation and what we are facing relative to the mental health for Canadians. In that meeting, we had an alarming testimony from Michelle Eaton, the CEO of the Canadian Mental Health Association. She said, and I quote, "We are already seeing signs of a potential echo pandemic of mental health issues as the result of COVID-19. Just last week, the CBC reported on the surge in demand for CMHC in Nova Scotia. It typically receives 25 calls per day and was fielding 700 calls for mental health and support. These requests came from people without a history of mental health. She also said that the phones at the CMHA centers across the country are ringing off the hook. And this was a couple of months into the pandemic, and so I can only imagine what that's like now. There's no doubt that mental health needs to be a priority for all of us right now. And we need to be having an informed strategy on mental health going forward. But most importantly, we need to act while we still have time before this crisis becomes worse. And I'm by no means suggesting that studying mental health is the only good idea, much less the only key issue servicing from this pandemic. One of the strengths of the studies in the smaller scope is being able to make well-informed, targeted recommendations that will help make a real impact on the lives of Canadians. And that's why I proposed a motion for the committee to study the impacts of COVID-19 on the mental health and well-being of Canadians, including recommendations that look specifically at understanding the impacts, including gendered impacts of COVID-19 on the mental health and the well-being of Canadians, the impact on Indigenous peoples and racialized Canadians and vulnerable populations, and the availability of mental health promotion programs and supports for those experiencing mental health related stress and the anxiety, and how to support the offices that were going to be overburdened with this. We also need to understand the effectiveness and the availability of virtual mental health services and how our government can assist provinces and territories. All of us have an opportunity to get ahead of the second pandemic. And if we don't take the appropriate steps now to act while we can, the outcome will be on all of us, especially on those who choose to move forward without giving the matter the attention it deserves. I urge my colleagues in committee to support this study for Canadians in my riding, in their riding, and across the country. Mr. Chair, I move that we resume the debate on my motion with respect to studying mental health.
Thank you, Mr. Van Bynen. I believe that's a motion
to resume debate on my motion.
Right. I believe that is a non-debatable motion. So I guess we'll go to a vote on that at this point. Are we? Do I have consent of the committee to adopt this motion? I'm seeing some dissent, so we'll have to go to a vote. So, Mr. Chair, would you please? Sorry, Mr. Clerk, would you please conduct the vote?
Monsieur Thériault.
Monsieur le Président, j'ai...
Mr. Chair, I lost the sound for a certain period, so could you just start from the beginning of what you were saying, please? It seemed that there were some technical problems and that some colleagues are having trouble getting connected, and although Mr. Davies told us last time that we couldn't criticize your vision, that is, if we raise the hand. But this morning, I raised my hand before Mr. Van Bynen, and I was not recognized. So could you just please start again and tell us exactly what we're doing, where we are? We also have to take into account that there is a delay in the sound.
Did you want me to start right at the beginning when I began the meeting, or just after Mr. Van Bynen's speech?
No,
No, I'm not going to be difficult here. I just want you to say again what you said after Mr. Bynen spoke, because I lost a lot of that, of how you were thinking what the approach should be.
Mr. Thériault. So Mr. Van Bynen has moved to resume debate on his motion. So I asked the committee if the will of the committee was to accept the motion, looking for unanimous consent. I saw some heads shaking, so we will therefore go to a recorded vote on the matter. So the vote on the floor at this time is whether to resume debate on Mr. Van Bynen's motion to study the mental health aspects of COVID-19.
Mr. Chair, I have a point of order, just a clarification. I think you've done it, but I think it'll really help committee members. So we're not voting on whether or not we want to adopt the motion. We are voting on whether we want to debate the motion. Is that correct?
That is correct.
Thank you.
Okay, so Mr. Clerk, once again, if you would start the vote. So a vote for yes means that we would resume the debate. A vote no would mean that we would not. So Mr. Clerk, please go ahead.
Okay. So, Monsieur Thériault?
No.
Mr. Barlow?
No.
Mr. D'Entremont?
Nope.
Mr. McGuire?
I'll be voting no.
Mr. McGuire? Mr. Dalton?
No.
Mr. Fisher?
Oui.
Mr. Kellaway?
Oui.
Mr.
Pawlowski? Yes.
Ms. Sidhu?
Yes.
Mr. Van Bynen?
Yes.
Mr.
Davey? No.
And
Mr.
McGuire? Can you
Mr. McGuire, perhaps you might check the mute button that's on your headset as well as the mute on the screen.
Point of order, I think he just dropped off the call there. So can we just wait till he gets on? I think I've lost him completely there.
He's still there, but he's lost his picture. I know he was having problems earlier.
Mr. McGuire?
Mr. McGuire, maybe you can give us a thumbs up or thumbs down. Okay. So I say that as a no from Mr. McGuire.
So we have 5 yeas, 6 nays.
Okay, the motion is defeated.
Monsieur le Président?
Yes.
Mr. Chairman, please. I would like to introduce the following motion that pursuant to Standing Order 1082, the committee undertake a study on the Patented Medicine Prices Review Board guidelines issued on June 15, 2020. That as part of this study, the committee invite experts and pharmaceutical industry representatives, as well as civil society organizations or associations representing patients to appear, that the committee hold a minimum of 4 meetings, that this study be conducted in parallel with the committee's study on COVID-19. Additional meetings should be added to the committee's schedule if the committee deems it necessary, and that the committee report its findings and recommendations to the House, and that the government provide a response to these results within 30 days. Mr. Chairman, I would like to start with the end so that we understand clearly. It is important, since the guidelines are to be implemented and enacted on January the 1st, that the government get back to us and respond quickly. The motion is intended to allow us to hear from experts, those that are in favor of the guidelines, others that are against the guidelines, not against the spirit, that is, the idea of being able to control the price of patented medicines, but against the negative effects that the guidelines could have, especially in the view of patients that have rare diseases and the associations representing them. There have been consultations, but they were held mainly behind closed doors. We want to have all of the representatives, and in particular patients, able to come and express their views to us as legislators, to make recommendations so that we can make informed recommendations. Because the idea behind the guidelines are good, but we have to look at the overall effect. Medication over the next 15 or 20 years, if we look just at the cost, obviously, in that case, the idea of what is therapeutic will be very narrow. But if we look at medication as part of our overall quality of care, then it's a different approach. So we need to see how these changes will impact the overall economy of the pharmaceutical industry and life science industries. So I'm not completely decided on how I feel about these guidelines. I'm open, but we need to hear from these witnesses. There may be a motion from the House within the next few days. We might have a reference from the House to look into COVID issues, but we can do more than one thing at a time. We can walk and chew gum. So we can look at how we could deal with this issue quickly because we will have it coming into force in January. So when I talk about a parallel process, we should be able, as I mentioned in my motion, to hold additional meetings. So I would ask all of my colleagues who are sensitive to why patient advocacy groups are concerned, that these groups should be able to be heard by the committee. So I will stop there. I think I have clarified what I'm proposing, and we will go from there. Thank you.
Thank you, Mr. Theriault. Next on my list is Mr. Kellaway. Mr. Kellaway, please go ahead.
Thanks, Mr. Chair, and hello to everybody for our third meeting. Seems like we've had a few more meetings than three, but nonetheless, I certainly would like to speak to Mr. Theriault's motion. One of the many reasons, I got involved in politics and decided to run was around healthcare, whether it was the need for more doctors, nurses, specialists, but also around pharmacare and around the cost of drugs and other things. It hits home to me personally, having a mother that is ailing, persevering but ailing, and I look at what is covered and what is not covered, and I really appreciate Mr. Theriault putting this forward, and he mentioned something that I think is really key. It's important to hear from big pharma, pharmaceutical companies, but it's also really important to hear from the end user, from the family of 3 or 4, the individual that needs a voice and needs to be able to provide, I think, some sound intel and learned experience. And the last couple of meetings and the meetings that we had prior to the summer, I even the meetings that we've had to date, we've disagreed vehemently on key things. And in the last session, we did as well, and we got some work done. And I think this is something certainly that is important, Mr. Theriault, through you to the speaker, to you rather, that it impacts all Canadians, and that's what we're here for. So I really respect the fact that this has been put forward, and it's something that I look, hearing from my colleagues on, but it is certainly one that has such a transformational impact on every single Canadian, and that's why we're here. So I just wanted to send my appreciation to Mr. Theriault for that motion from a personal perspective and from a community perspective, but from a Canadian perspective as well.
Thank you, Mr. Kellaway. We go now to Mr. McGuire. Mr. McGuire, you're muted. Check the switch on your headset. There's a switch on your headset. Make sure that it's not muted there.
There. Still nothing?
No, now we hear you. Now we hear you.
You got it? Okay, yeah. Sorry about that, Mr. Chair. Yeah, no, I believe Mr. Theriault's motion here, it is about healthcare, and we need to move forward with it. I certainly think that it's a very valid motion. We're looking at the situation of being able to deal with all of these issues in COVID, and certainly this is just one of many. And I think that's the motion we need to be looking at and moving forward with. Mental health is extremely important, and that's why it's included as part of these motions. I do think that we've got an excellent opportunity here to be able to deal with the issue that's most important to Canadians. And I think that it's something that it's on everybody's mind out there. I mean, I flew home this weekend. You want to look at a situation of everyone protecting themselves and helping others by wearing masks, by doing all of these issues that we've, distancing as much as possible, even in our airports and airplanes. And so I think this is, the issue that Mr. Theriault has put forward is one that's urgently needed and to be discussed. We just need to make sure that we can move forward with motions like this. And I think it's excellent to be part of the motion on COVID discussions that we will need. There may be others that come forward as well in debates that we're going to have and discussions on these motions that we're seeing. But I think across the country, when we're seeing the increases in the numbers of COVID victims, people getting COVID-19 every day, the more urgent that we can, the more breadth that we can add to these motions, the better. And I commend my colleague from the block for putting his motion forward and being able to make sure that it's included in the whole discussion that we're having today. I just, Mr. Chair, I look at the motions that we've had before, where we were looking at, including mental health as a part of those whole discussions. And I think that that's a very sound way to go. We've got an awful lot of circumstances where, I guess we're to be blunt, just where we need to have more discussions on a broader base. There's a number of areas where we need information to be able to move forward, to be able to have discussions with the minister when the minister arrives at our committee meetings. And I think, sorry, Mr. Chair, get rid of that. And so I believe that we need to, we need to move forward as much as we can with these types of motions. And I think that, if that may be all I'll say on it for now, but I think we need to be able to move forward as quickly as we can with a broader discussion of the whole area of what's required for the discussions that we're going to have as we go forward. And so I think that if other members of the committee want to chime in on that, I guess we would be quite happy to hear what they have to say. But I think it's mostly the inclusion of motions like this, or a motion like this, along with all of the other areas that have been talked about that would be most important to Canadians.
Thank you, Ms. Maguire. We go now to Monsieur D'Entremont. Go ahead, please.
Thank you very much, Mr. Chair. And I just wanted to make sure that we sort of register our support for Mr. Theriault's motion. This has been an important issue before Canadians in Health Canada for some time now. It's been our position for quite some time, since the changes, or the task force recommended changes back in 2018, that any of these implementations so far, that they will negatively impact the lives of Canadians who depend on medications. You know, we're finding that they set aggressive price ceilings for some of those therapies, including those that we hear on a regular basis when it comes to rare disorders. You know, I don't know how many questions has been asked in the House of Commons at this point when it revolves around the issue of access to Trikafta. You know, so we don't feel, from what we saw, what we would qualify a dump of information on a Friday morning or a Friday, that it will truly make a change or address the concerns of the different patient advocacy groups when it comes to access to those medications. Like I said, we were sitting on a conference on Friday with CF Canada, which we're very happy to participate in. Mr. Theriault was there, Mr. Fisher was there as well. And I thought we had a really good understanding and conversation of what would be good changes and what would be bad changes, and what the concern of that group would be. From our precursory look at the changes, there's very little change there. I quite see it's going to be a barrier to access, or a barrier for Canadians' barrier to access to these different kinds of therapies. So I really think this is a great idea to study it. And I also like and respect the request from the honourable member when it revolves around the issue of doing this congruently, or at least together. You know, we can walk and chew gum at the same time. We can look at different things at the same time, which is why I think, you know, we can have a COVID motion going on at once. We can look at PMPRB. We could look at mental health. You know, there's things that are, of course, included in many of our motions to this point. So just to quickly say, to thank the member from the bloc, our friend Mr. Theriault, to make sure that we look at something that's very important to Canadians, and hopefully we can influence at least some more changes, or at least a delay of some sort on the implementation of those changes, as we don't see them actually helping Canadians any further.
Thank you, Mr. D'Entremont. We go now to Mr. Davies. Mr. Davies, go ahead.
Thank you. I'd also like to add my thanks to Monsieur Theriault for moving this important motion. The PMPRB changes have been in the works for several years now. In fact, I would argue they're overdue. They were supposed to be implemented January 1, 2020, and then that was delayed to July 2020, and now they're delayed again to the end of this year. I think it's important to note that there are positive changes in these regulations and some concerns. The positive aspects of them are, there's no question that PMPRB reform is necessary, and these guidelines will reduce prices, the drugs that Canadians pay, and they also will increase transparency in the pricing process. But as has been pointed out by some of my colleagues, there are concerns raised in the public, and I think in the pharmaceutical industry, that these changes may impact negatively the availability of drugs in Canada, and there's quite a bit of controversy around that point. Some believe that that's the case, some don't. So I think it's very important that we do take a look at this. I would suggest one thing, though, and that is in terms of how we proceed with this study. So the elephant in the room, of course, right now is this motion that's going to be voted on by the House tonight. If that motion passes, then this committee will be directed to study COVID, which I believe there's agreement across all party lines at this table that that is the #1 public health issue facing our country. I'm concerned about House resources and how we would be able to proceed with 2 studies at the same time. In my 5 years on committee, I may be wrong, but I don't think we've ever done that. And that doesn't mean that we can't. What I would suggest, given that we're in a very unique situation now, because in normal circumstances, we could just schedule more meetings. Now, of course, with the technology issues and the limited resources of the House, I'm not sure that we even can be meeting more frequently. I would point out this committee is still only meeting once a week, when it is our normal practice to meet twice a week. And that, I'm told, my understanding is because there is a lack of resources and support for things like interpretation and, of course, technology support. So what I'm going to suggest is that we do vote for this study and we do proceed with it simultaneously, but we do it in this fashion. I think we start with a briefing from the PMPRB itself so that all committee members know what the changes are. And I know there were guidelines that were issued on Friday. I've read through them. It's a very complicated area. There's no question that this is not an easy thing to digest. So I think before we hear from anybody, we need to understand as committee members what exactly is being proposed in the PMPRB changes. What are they going to do? What are they not going to do? And then I suggest that what we do is we invite the witnesses that Mr. Theriault has identified to send in written submissions to the committee. And then once we get those written submissions, we can then, armed with an understanding of what the PMPRB changes are and with what the position of the stakeholders are, we can then narrow down and decide to hold hearings and hear evidence from those witnesses that the committee feels are important to hear from firsthand. And that way we get the PMPRB study undergoing right away. We start with a solid understanding of what the changes are. We create a portal for all of the stakeholder groups that Mr. Theriault has identified to actually get their input into the committee, which is something they desperately want. And then we can be in a better position to use our very limited time wisely. Maybe it's late November, maybe it's early December, to hear, maybe it's 1 meeting or 2 meetings or 3 meetings. I'm not sure how many we will need to hear from witnesses in person about their changes. I'm going to conclude just by saying I want to just add my voice to and thanks to the cystic fibrosis community in Canada, who have done a great job in raising this concern. And of course, they use the example of the fact that patients are not getting access to life-saving and life-improving medications now, which is Trikafta. And speaking for my party, we believe that every Canadian should get the drugs that they need when they need it, without regard to their ability to pay. And there's clearly an issue, but I think there is a very, very live issue as to why they're not getting that medication. The pharmaceutical industry is blaming that on the PMPRB changes. Others say that that is not the case, that big pharma, there's other reasons why those drugs aren't available. So I think we do need to look into this issue and get to the bottom of it. But I think that if it's okay with Mr. Theriault, if that process is okay with him, I think that accomplishes everything that we want to do. And finally, again, if the House motion passes tonight, we'll be directed to study the COVID issue. We will have no choice about that, and we'll proceed with that. So it allows us to, as he says, chew and walk and chew gum at the same time, but in a manner that I think is an intelligent and efficient use of our time and resources.
Thank you, Mr. Davies. We go now to Mr. Fisher. Mr. Fisher, go ahead.
Thank you, Mr. Chair. And I'm not sure whether Mr. Davies was moving an amendment there or just making a suggestion on how we might proceed, assuming that we have support for this. And I'm happy to support Mr. Theriault in this. I understand the points that Don made, and some of them certainly will be impacted by the outcome of today's vote. In Mr. Theriault's motion, it talks about the regulations from June. And I wonder whether Mr. Theriault wants to look at the regulations and the new guidelines that were released on Friday, as some of them had changed. Two of them changed. You want to go back to June? You want to stick with the ones that were released in June, not the new ones that were released October 23rd? And I guess, Mr. Chair, is that okay if I ask that question of Mr. Theriault?
I believe you could ask him on a point of information and keep your speaking order.
Okay.
Mr. Theriault, did you wish to respond to Mr. Fisher's point of information?
When I read the motion out just a little while ago, I did mention in the sentence about the former guidelines and that date, then I updated it. So I mentioned I would like us to study the October 23rd version of the guidelines, indeed.
I was listening to your when you read the motion out. I was listening through the English-French translation, and I didn't catch that. So thank you for that. I am happy to support this. And Don said he had gone over quite closely the new changes. I was also, as he said, on that great Zoom on Friday with probably 20 or 30 parliamentarians, which was great. But I haven't had the chance yet to dig through the details as well on the changes that were made, just the two major ones that Luke and Don and I and Elizabeth May and a few others talked about on Friday. So I will support this motion, and I want to thank Mr. Theriault for bringing this forward. I think that what he's asking here is something that's not only important, it's framed in a way that we're seeking the information we want to get, and I'm glad to see, although I'm very disappointed that we once again didn't get a chance to talk about Mr. Van Bynen's very important motion on mental health as it pertains to COVID-19. I'm an eternal optimist, and I do hope that we will make sure, as Mr. McGuire had said, that we will give a high level of discussion to that topic in the future in this committee. So, Mr. Theriault, happy to support. Thank you, my friend.
Thank you, Mr. Fisher. We go now to Dr. Pawlowski, please.
Thank you very much, Mr. Chair. I certainly support this motion. I welcome the return to discussions regarding healthcare rather than about politics. And there's been a lot of talk lately about our filibustering. I just wanted to point out in the last few meetings, I was filibustering. I'm just someone who's naturally likes to talk a lot and talks very slowly. You can ask my wife about that. So let's get back to talking about health. And so I do like this subject. It's a very interesting one. Apparently, Canada charges, in Canada, we have some of the highest prices for patented drugs in all developing countries. But the issue of patent protection for medications, and especially essential medications, is a very complex issue. In order to recoup the cost of developing a drug, I've heard a number. Now, this is a few years old, but I was told that pharmaceuticals have to be able to sell about $1 billion worth of a medication in order to recoup the cost of developing a medication. Not just that one medication, but for every medication that they come up with, which they can actually market, there's a whole bunch of other medicines that don't get that far. And so it's really important to allow pharmaceutical companies to charge an adequate amount for their products. Otherwise, there's no incentive to carry on research. And obviously, and we've seen that, for example, with Trikafta, it's a medication that can really substantially help a lot of people. So we certainly want to ensure that the incentive for pharmaceuticals to carry out research remains, and that means allowing them to charge adequate prices for medications. However, it's also important to allow people, both in Canada and globally, to access essential medications. Now, this play out between two opposing concerns, allowing pharmaceuticals to make adequate money to compensate for the development of drugs versus allowing people to access affordable medications. This battle was played out a number of years ago in Africa in relation to access to antiretrovirals for the treatment of HIV/AIDS. I don't know if you remember, but back then, antiretrovirals were exceedingly expensive. Africa was being devastated by the HIV pandemic. And so this issue came before the World Trade Organization at that time, and WTO reaffirmed what's called the TRIPS flexibilities. The TRIPS is trade-related aspects of international property, and their flexibilities, which allow poor countries to be able to access medications which are still under patent, and make those medications affordable when a country needs to, for the sake of public health of its citizens. So this battle has been played out, and there are certainly competing interests. And I think with respect to the proposed the actual changes to the Patented Drug Prices Review Board, I think we see a lot of these same sort of considerations taking place. So I do agree that is something that's worth studying. It's a complex issue, and I welcome us spending some time doing it. I think the suggestions already made as to how we do it concurrently with continuing studies of COVID is something that is certainly desirable. And I guess since I have the floor, Mr. Speaker, can I ask, I do have a new motion. Would it be the time to propose a new motion now, or when can I propose a new motion?
The motion would not be in order at this time since we are engaged in debate on Mr. Theriault's motion. But I can put you on the list for once we dispose of this motion. Are you done?
Yes, I'm done.
Okay, thank you. Ms. Rempel Garner, please.
Thank you, Chair. I was just wondering, similar to what happened before, if I could just ask Mr. Theriault a point of clarification related to some of the suggestions that have come up both from Mr. Fisher and from Mr. Davies. So specifically, I was wondering if Mr. Theriault would be amenable to allowing the process for this motion to roll out is that the committee would request written briefs to be submitted by the 6th of November or somewhere thereabouts, and then we schedule witnesses based on the written briefs. And this is just out of the reality of potentially running two studies at one time, and realizing that opposition members have like 2 or 3 staff. You government members get a lot more than that, but it's more of a way of facilitating. So that's what we were kind of hoping he would be amenable to do. And I think it's what Mr. Davies had asked for clarification on, and I was just hoping he could speak to that.
I will ask Mr. Theriault if he wishes to speak to that. I would point out that, we can, if this motion passes, we can decide on how to proceed accordingly. And we will have more committee resources available to us after this week. So, Monsieur Theriault, did you wish to respond to Ms. Rempel Garner?
Oui,
Yes, thank you, Mr. Chairman. What's important to me is to adopt the motion today as to how we decide to do our work. I'm open. And of course, the various groups, the advocacy groups and so on, are already ready because they've already submitted briefs. But the issue today is to enable people to express their views. Everything was done in writing and in a very behind closed doors way. There are people who want to speak publicly, and I think we need to hear from them as quickly as possible. Of course, there are people. I think we could try to hear from all of those that want to appear because they are really grouped into sectors. There are industry groups, there are representative advocacy groups, and so on. And there are, of course, some more neutral economists as well who find it very difficult right now to measure the real impact that these guidelines will have, not just on the initial cost of medications, but the impact as the years go on therapies, in oncology, neurology, and so on. And Trikafta is a very good example of that. So I want us to go ahead and look into this. We can discuss how we need to adjust our approach and how we implement the motion. I understand that everyone is in favor of going ahead with this study, and I am absolutely convinced that we will be able to work together to carry this out. So I'm very optimistic about that.
Thank you, Mr. Theriault. So that was on a point of clarification for Ms. Rempel-Garner. Ms. Rempel-Garner, you still have the floor.
Great. Well, I think in a positive way forward for the Health Committee, I think we have some consensus on how we can move forward, and I want to thank Mr. Theriault for that. I also think that there's just I'm sensing some desire to put some clarification around the timeline, both for stakeholders and just for committee members to be able to plan work schedule, especially in light of the COVID-19 study. So what I would like to do, and I will look to Mr. Theriault for whether or not he wants to support this, but I think there's a desire to amend the motion just to clarify the written brief submission. So the amendment that I would move, and this is up for debate, would be after the line that reads that additional meetings be added to the committee's calendar as the committee deems necessary. I would add the line that the committee issue a request for written briefs and request to appear by the end of the week with a submission deadline of November 6, 2020. And here's my thoughts on that for Mr. Theriault. This would allow so first of all, my understanding is that at this point in time, this is the only meeting that is currently scheduled for the Health Committee this week. And then we'll have meetings next week should the motion around COVID pass in the House. I'm assuming that one of those meetings at the very least would be an organizational meeting to get ready for the House of Commons, the House of Commons direction on COVID. So I don't want 2 weeks wasted and then we're not scheduling witnesses out for Mr. Theriault's study until the end of November. So this is sort of like it would be a very clear signal to the stakeholder community to augment this. So what we would be saying is, please submit written briefs for consideration by the end of next week so that there's movement on the study so that the clerks can start considering this information. And then we would start scheduling witnesses out once we have some clarity from the House on when additional resources could be provided. And here's the other thing that I'm thinking for Mr. Theriault. The week following the 6th is a recess week for the House. So we could I'm assuming that there's not as much drain on resources that week. So as we're doing a concurrent study, it would allow us to then schedule witnesses out that week and plan work. So I'm hoping that Mr. Theriault would be amenable to that. And the reason why I'm moving it now is because I'm not sure when we're going to have another meeting to discuss work plan. And I would just hate to see his motion not get scheduled until the end of November. So it's more of a help for him. So if we give direction on this today, we can start asking stakeholders for briefs. We can start the work right away. And then our stakeholder community will be happy with that.
Thank you, Ms. Rempel-Garner. Are you moving an amendment?
Yes, I moved it.
Okay. So the motion is on, sorry, the debate at this point is on Ms. Rempel-Garner's amendment. And next on my list, I have Monsieur Theriault. Monsieur Theriault, please go ahead. Speaking of.
Absolutely, Mr. Chairman. If I have understood correctly, and we'll see what the amendment says in writing, but we would invite people to submit written submissions, and we have to make it clear that we are willing to hear from them. We don't need to strike a subcommittee. We can go ahead with this right away. And that's what I'm expected. I want us to move ahead with this study, and so I'm quite happy to have this amendment added so that we can speed things up.
Point of clarification, Mr. Chair, if you'll just beg the indulgence, that was exactly
yes,
the intent.
Ahead.
That was exactly the intent of the amendment. So of course, we're going to have witnesses, but this would allow the committee to start work concurrently without having to wait for a meeting to be scheduled to deal with scheduling at a date unknown.
Thank you for your clarification, Ms. Rempel-Garner.
Mr. Chair, could I just have just a quick point of order, or again, a point of clarification? Sorry. The House motion that we vote on today takes precedence over everything. Is that the case? And is this amendment then going to create some type of parallel? I mean, I want to make sure that Mr. Theriault gets what he wants, but if this motion passes today in the House, my understanding is we wouldn't get to this study, but that's just the clarification I'm seeking.
On that point of order, Mr. Chair.
Go ahead, Ms. Rempel-Garner.
My understanding is the way that Mr. Theriault has worded the motion, this motion would happen concurrently should the House motion pass. I believe it's right in the wording of the motion.
Thank you.
Okay, then just one more point then. Can a motion of the committee do that when the motion of the House supersedes the committee?
I'll stop the debate here. We're kind of got into a side issue. You know, that the motion of the House will give us a reference that we are committed to, that we're obliged to follow. It is not necessarily exclusive, however, as long as we can fulfill the intent of the House motion and do other things, it's kind of up to us to manage our business. Anyway, let us carry on with Mr. Davies. Mr. Davies, you're up next. Please go ahead on the amendment.
Thank you, Mr. Chair. Well, thank you to my colleague for moving the amendment. Thank you for Mr. Theriault for his indulgence. Yeah, I just think we need just a little bit more shape to this. So the beauty of the amendment is, if it's adopted today, is we can invite the stakeholders immediately to start sending in their feedback to us in written submission form. And as Ms. Rempel said, if we don't do that, we're not going to be able to have any input from any patient groups, I would say, for at least 3 weeks of any type. So this way it gets action on Mr. Theriault's motion immediately. But I want to be clear, I think it also has the additional benefit of helping the committee, once we get those written submissions. I think there's a deadline in Ms. Rempel's motion of, was it November 6th, if I have it correct? That's the deadline for written submissions. It will allow us then to select from those submissions, if we have many, to focus in on representative groups. For instance, I don't think we need to hear from, 11 patient groups who are going to tell us that the same issue. Nor do we need to hear from many pharmaceutical companies who have the same testimony. It'll allow us to zero in on where the committee wants to focus in terms of the oral testimony. I do want to state for the record, I think it's very important that we do provide an opportunity, particularly for patient groups, to appear before committee and give us their views on the changes in person. I know there's frustration with the process so far. I think it needs to be said that there have been a number of opportunities for stakeholders to submit their written submissions to the government on the PMPRB changes over the last several years. And I think what patient groups want is a chance to get in front of parliamentarians in a personal appearance format, and I think that needs to be encouraged, and we need to facilitate that. But as a matter of pragmatic scheduling, the way I'm viewing this, and I want to be clear with that I understand this, we give everybody until November 6th to get their written submissions in. Then the committee will take a look at those submissions, and then we will decide as a committee who we need to hear from, and we will schedule. I think it's up to 4 meetings is the motion, if I understand correctly, to schedule a representative sample of the viewpoints, and that's where I'll conclude. I think it is important to get a representative sample, because again, I will point out there are patient groups and there are experts who very much support these changes, and there are those that do not. And I think committee needs to hear the full range. And I think by getting the written submissions, it'll give the committee a really good sample from which we can choose to make sure that when we do have our verbal meetings, that we have canvassed a very good representative sample of those different points of view.
Thank you, Mr. Davies. We go now to Mr. Fisher.
Thank you. And I wonder, Mr. Chair, if we could ask the clerk just about the concurrent portion and ensuring that when a House motion comes to us, that we can still run something. I know what Don's saying. We can certainly get the written submissions, but when it comes to scheduling a time to have people appear before us virtually, I just wonder if the clerk would chime in on what the House motion is going to direct the Health Committee to do.
Thank you, Mr. Fisher. I will ask the clerk accordingly. Mr. Clerk, if the motion before the House at this time passes, what is our ability to do a concurrent study?
Well, depending on the resources, of course, but we can do two things at the same time. Like, let's say if we get a bill from the House, it's an order from the House, we can do other studies or other meetings on estimates or whatever. It's up to the committee to decide. Of course, depending on the resources, but we can do it at the same time. It's up to the committee.
So a committee can determine to do a separate study, even though the House has demanded that the committee do a particular study.
If we have more meetings, yeah, sure.
Okay.
Thank you, Mr. Fisher. Are you done your intervention? Yes, okay. We go now to Dr. Pawlowski. Please go ahead.
Sorry, I withdraw that. I lower my hand. Sorry.
Okay.
No other than to say, I just lower my hand. Sorry.
I know that was difficult, but there you go. Mr. Kellaway, please go ahead.
Thanks, Mr. Chair. And I'll be quick because actually MP Don Davies brought it up just around the ability to have patient groups or pharmaceutical companies, whatever representative sample, and whoever makes up that representative sample, that we also take into account the ability to Zoom people in addition to written statements and things of that nature. I think it's going to be really key here to this particular motion. Thanks so much.
Thank you, Mr. Kellaway. Monsieur Thériault on the amendment.
Mr. Thériault. Mr. Chairman, as I mentioned earlier, I quite agree with the amendment. I even said that if we can save time, I would be happy to introduce the motion myself, or rather the amendment to make it part of the motion, and I can just reread the motion and include that amendment, if that helps.
Helps. We do have the motion, and we do have the amendment on the floor being debated. Once debate ends on that amendment, we can have a vote. I see no more hands raised on to speak on the amendment. Seeing no hands, I shall ask the clerk to conduct a vote. First of all, let's see if we have unanimous consent to adopt this amendment. Is there anyone who dissents, who does not agree with passing this amendment?
Mr. Chair, I just want to be clear. I think we have consensus here, but Ms. Rempel-Garner moved the motion on the written submissions. Do we have broad agreement? I don't know that I need to move an amendment to this effect that we're supporting the course forward that I suggested. That is, we get the written submissions and then we, as a committee, determine when the meetings will be and who we hear from. Is that?
We can't entertain another amendment at this time. We can vote on the amendment that is on the floor by Ms. Rempel-Garner. And if you wish to make another amendment following that, that will be up to you. But at this point, the vote on before us is whether to accept Ms. Rempel-Garner's amendment or not.
Can you then read the motion as amended, please?
I will ask the clerk to do so. Mr. Clerk, if you would please.
Well, I don't have the text, so it's hard for me to read it. So maybe Mrs. Rempel-Garner.
Okay. Ms. Rempel-Garner, if you would please.
So, Mr. Chair, it would be adding the following line after the line that reads that additional meetings be added to the committee's calendar as the committee deems necessary. And the amendment would be this: that the committee issue a request for written briefs and for a request to appear by the end of the week with a submission deadline of November 6th, 2020. So just to clarify, what we're asking for is we're asking the clerk to issue an open call for written briefs by the end of this week, and that those written briefs and requests to appear be submitted to the clerk by November the 6th, which is the end of the following week.
So are we all clear now on the amendment? Therefore, I think we just best go to a vote. Mr. Clerk, if you please call the vote.
Monsieur Thériault?
Je suis pour.
In favor.
Mr. Barlow?
In favor.
Mr. D'Entremont?
Je suis pour.
I'm in favor.
In favor.
Ms. Rempel-Garner?
In favor.
Mr. Fisher?
In favor.
Mr. Kellaway?
In favor.
Mr. Polowski?
In favor.
Ms. Sidhu?
In favor.
Mr. Van Bynen?
In favor.
Mr. Davies?
Je vote pour la motion.
I vote for the motion.
No, so, unanime. 11 en faveur.
So 11 in favor. Unanimous vote in favor.
Thank you, Mr. Clerk. So the motion passes, the amendment passes. The debate can continue now on the motion as amended. I see Mr. Davies has raised his hand. Go ahead, please.
Well, just now, again, I just want to test my colleagues. If we have a sort of understanding of how we're going to proceed, I don't think we need to amend the motion. But I just wanted to be sure that once we get the written submissions, we will then, as a committee, meet, or perhaps the subcommittee can meet, and we can determine. I think we've scheduled up to 4 meetings to hear from a representative sample of those who wish to appear in person. Is that, if that's my colleague's sort of understanding, then I think we can just proceed to the motion. But I want to know if anybody thinks differently about that.
So we have Dr. Pawlowski. Please go ahead.
Well, I guess I support the now as amended motion. However, with the caveat that the question of whether we have the resources to have an adequate number of meetings, given the motion that we're voting on in the House, certainly is of concern. There's only, my understanding, there's only so many open spots to do these committee meetings. It would be a real shame if this motion never actually got there before January 1st, which I think is Mr. Terrio's intention, that this be looked at by the committee before those changes go into effect. So I again kind of question our ability to do this given technical limitations should the motion before the House get passed. Thanks.
Let me point out to the committee that new resources are being added to the committee resources, if you will. Our ability to have meetings will be increased after, I believe, next week. So anyway, we have now Monsieur Theriault. Please go ahead.
The whips will decide which meeting will be sold.
Yes, as the clerk says, the whips will decide who gets what priority, but there is more capacity coming. Monsieur Theriault.
Mr. Theriault. Mr. Theriault, please go ahead. Thank you. Mr. Chairman, I think that we have to make sure that we follow the actual motion, so we have to keep that in mind. I say here a minimum of 4 meetings, so that's what I'm suggesting. Of course, we can, in my opinion, spend more than 4 meetings. It might take less or more. We'll have to look at the methodology suggested by my colleagues. Maybe it would mean that we only need 4 meetings, but I've said here a minimum of 4 meetings. In addition, we're going to be sending this invitation to submit written submissions and to perhaps appear before the committee. So I'm not concerned about who we will be hearing from because everyone is open to hearing from all sides. But in particular, we need to hear from patients because some are saying that if the rules were adopted as they stand, the guidelines could make it more difficult to access new drugs in upcoming years. And I'm very concerned by that possibility. So during the whole PMPRB process, what people are criticizing is that they haven't been able to be heard. They want to come before our committee and speak. The methodology is important, but it doesn't really matter to me how we proceed. We need to propose witnesses, and as we've done before, every committee can suggest witnesses. Certainly, we can vote on the motion today and then decide on our approach.
Thank you, Mr. Theriault, on the clarification of the wording of the motion. My recommendation to the committee is to not get too deep into process issues right now. We can, if this motion passes, we can carry on and do our work plan and so forth accordingly. Ms. Rempel-Garner, please go ahead.
Briefly, Chair, thank you. Just to both of my colleagues, I want to thank them for working so collegially. I'm sure, as the clerk said, we can find the resources to do both, both the COVID study and this study. There are standing order provisions which can compel a meeting to discuss the work plan, as Mr. Davies has suggested, which, if necessary, we can absolutely do that. I would support that approach. And I think that us adopting the motion as amended and proceeding in the way that we've just discussed will allow patients and other groups, et cetera, to get some clarity on the study moving forward. So my congratulations to Mr. Theriault, and my thanks to my colleagues for clarifying this motion, and I look forward to getting started on the study as soon as possible.
Thank you, Ms. Rempel-Garner. I see no more hands raised. We'll go to a vote on the motion as amended. Mr. Clerk, if you would please call the vote.
Monsieur Theriault?
Mr. Theriault, I support the motion.
Mr. Barlow? Mr. D'Entremont?
Oui.
Yes.
Support the motion.
Ms. Rempel-Garner?
Support.
Mr. Fisher?
Je vote pour la motion.
I vote in favor of the motion.
Mr. Callaway?
Oui.
Yes.
Mr. Polofsky?
Yes.
Ms. Sidhu?
In favor?
Mr. Van Bynen?
In favor?
Mr. Barlow?
In favor?
Okay. So we, Mr. Davies, sorry, Mr. Davies?
Oui.
Yes.
We have 11 yeas, no nays.
I'm sorry, Mr. Clerk, I missed
11 yeas in favor, 11, and 0 nays.
Thank you, Mr. Clerk. It would appear that the motion has passed as amended. Thank you all everyone. And now, Dr. Pulaski, I said that I would put you first on the list after this matter was disposed of. So Dr. Pulaski, please go ahead.
Okay, so I want to propose a modified version of the House motion that's currently before the House. Yes, I'm trying to reinvent the wheel, but this is providing an alternative so that if the vote today, we vote against the motion, there is an alternative motion before us and an alternate path. So having said that, here is our motion. That pursuant to Standing Order 1082, the committee receive a briefing from the analysts and report its findings and recommendations to the House as regards to study on the Canadian response to the outbreak of the coronavirus that it had undertaken in the first session of the 43rd Parliament, and that the committee then commence a study on the emergency situation facing Canadians in light of the second wave of the COVID-19 pandemic, and that this study evaluate, review, and examine all issues relevant to this situation. The initial 5 topics that shall be studied will be determined by each party submitting a ranked list of their top 5 priority study areas to the clerk by October 27th at 5 p.m. so that he can prepare a ranked list. Each party will be entitled to 1 witness per 1-hour witness panel and 2 witnesses per 2-hour witness panel, and that we request pertinent documents topic by topic after hearing from the witness and ascertaining which documents are relative to a productive study of the issue. I think that the issue in the change regarding what documents would be required is an important change to what has been proposed in the motion that's before the floor. Certainly, we've heard a lot of discussion from various interest groups, various manufacturers about the implications of the motion before the House. This would allow us to tailor the request for documents topic by topic. I think that's important. So, for example, I know that in the motion before the House, there are provisions to protect things like contractual obligations with respect to vaccines. However, that doesn't seem to be there with respect to PPEs. And certainly there was a concern by manufacturers that the motion before the House could lead to revealing contractual details between companies and companies that have done a lot of work to refit their plants in order to make PPEs. There's also, I think, some concern about trade secrets being revealed. So I think when it comes to PPE, we may want to have a slightly different request from the government in terms of what documents are required. Similarly, I think with the issue of vaccines and what documents are required in relation to the vaccine deals the government's made with other countries, again, certainly there's a lot more concern there about contractual details being revealed and that possibly harming our ability to secure the vaccines that I think everybody knows is essential to our getting out of this deep hole that we're in as a result of COVID. There's another concern, I think, with respect to procuring documents regarding vaccines and redactions is there will be redactions even based on the motion before the House. There will be redactions from that material, but I think that's really going to be problematic because I think, as a lot of you out there realize, there's a lot of conspiracy theory hovering around vaccine. Some really, really crazy stuff. I've heard seemingly intelligent people telling me that they believe that the virus was developed by Microsoft so that then we're going to have a vaccine and we're going to inject little microchips into people. Now, this is crazy idea, but a lot of people believe this. And so as soon as you produce all these documents by the government with respect to vaccines and you have these blacked out segments, there's going to be a lot of concern that people are going to read into this. What are they hiding from us? They're hiding something. So I think in the present motion before the House seeks to procure all this vast number of documents. I think this is a war. We're in a war against COVID, and we don't want to do anything wrong. And I think the current request for documents is problematic, and we're hearing it from companies. I think it probably is all of our best interests to try to refine it, hone it down a bit. And because of that, that is why I'm putting out my motion as to an alternative path. Thank you, Mr. Speaker.
Thank you, Dr. Pulaski. We go now to Mr. Barlow. Please go ahead.
Thank you very much, Mr. Chair. And I have to say, I think this is the first time in my parliamentary history, my years as a member of parliament, where I've had a colleague say that actually revealing documents and transparency will add to misinformation that's out there. My colleague, Mr. Pulaski, I'm really surprised. I would say that I think the best step forward would be the motion that we have at the House today because of that information or that misinformation that's out there for Canadians. Don't you think the best solution to that would be to reveal the documents and reveal the path and decisions that went into getting us to where we are? And, you know, there's a very strong list of exemptions that are in that motion. And we had this debate last week. We debated this, through a full day. And we said time and time again that there are exemptions in the motion to ensure that we protect some of those things like deals with or agreements with corporate Canada. But I do find it interesting that you're concerned about this. But the Minister of Health has put in an interim order that gives her special powers right now to compel drug companies across Canada to give her documents. So there's a bit of hypocrisy here when you are concerned about revealing trade secrets or agreements with corporate Canada and drug companies through the documents that we're requesting. But the government has no problem whatsoever allowing the Minister of Health to compel the drug companies and corporate Canada to give those same documents to the government. So I think it's really important that we have transparency through this. And I know my constituents, and getting many of the same questions Mr. Pulaski is, but they want to know what decisions were made for us to get here. And I think we should be just waiting for what happens with the motion that's in front of the House today. We're going to be voting on that. And then if it fails, Mr. Pulaski can bring his motion up afterwards. But all of the opposition parties seem to be in support of the motion that's in front of the House today. The only group that isn't is the Liberal Party, and I think that shows that the opposition parties have worked together to put this forward and ensure that we are supporting our constituents who want some answers, and they are worried about their health, they're worried about their safety, but they're also worried about their businesses and their jobs and their families, and they want to know, the details behind, why was our early warning system dismantled? Why do we not have access to rapid testing? What is clearly, to Mr. Pawlowski's question, what is the future with vaccines? Is it going to be accessible? How is it going to be distributed? Who is going to make those decisions? What are we basing our best practices on? So I think it's important for us to focus on the motion that's in front of the House today. We had this debate. We're putting the cart before the horse. Mr. Pawlowski, and you're already assuming that motion this afternoon is going to fail. And I think we've had this debate out there, and for you to be trying to neuter this already, I think is, despite the arguments that you and your colleagues had in the House last week, I think it's really important that we stand up for transparency, accountability, scrutiny of these documents, and understand, for us to know. And I just want to conclude with this: is there's a lot of arguments last week in the fact that we want to start looking forward. And I know Mr. Fisher and I had this discussion on a panel last week, is we want to look forward. Mr. Pawlowski, to you, if you were treating a patient as a medical physician, you would want to know, is that treatment working? You would want to go look at what the treatment has been throughout the process before you decided to continue forward, I would think. I would not say, you know what, let's not worry how I've been treating this patient for the past 8 months. Let's just continue on. We don't need to worry if it's actually working or not, or maybe it's actually harmful. You want to assess that process as you go along. And the argument from Liberals right now is, we don't really want to assess how this has been going. We just want to look forward. I think that is very wrong. I think we should be assessing this process every step of the way to ensure that we make the best decisions for the best outcomes for Canadians. So we cannot ignore how we got here, the decisions that were made to get us here, the dollars that were spent to get us here, if we have any hope of ensuring that we make the best possible decisions over the next few months. And I'm just going to conclude there. Thank you very much, Mr. Chair.
Thank you, Mr. Barlow. We go now to Ms. Rempel-Garner, please.
Thank you, Chair. So the Health Committee, the Standing Committee on Health, is tasked with looking at issues related to the health and safety of Canadians. And right now, we are in the middle of a pandemic. I am concerned about the fact that in several places across the country, we are seeing record numbers of COVID cases months into the pandemic. I am worried about people losing their lives. I am worried about regulations having to be put in place again to shut businesses down. And I think that there is no greater job for our committee right now than to be looking at, in a very pragmatic, calm way, is the federal government looking at this issue appropriately? Are there things that we need to do differently so that we can provide some stability to the Canadian public at this time? That is the motion that's in front of the House this afternoon. And I want to just remind my colleagues that that motion is for a vote this afternoon. Now, I want to address some of the issues that my colleague brought up. I did in a national press conference this morning already, but I will do it again. First of all, with regard to the issue of confidentiality, the motion itself has many different provisions for confidentiality, including the issue of confidentiality around the vaccine production, et cetera. The law clerk is tasked with doing the redactions. If the Liberals on this committee are concerned about that, we should have the law clerk as our first witness here. And the law clerk can tell us about their approach to redactions. And then if we need to, in the House, discuss that, there are ways that we can discuss that. But instead of trying to get to a yes, I can tell you what the Liberals did this over the weekend. And we know because we had pharmaceutical companies call our party and say, the government called us and said that X, Y, and Z was going to happen. What's going on? So instead of trying to get to yes, the government was trying to fearmonger on this stuff with pharmaceutical companies while we saw cases of COVID-19 grow. So at this point in time, I can only surmise that what the government is trying to do is orchestrate an election around this issue. Now, in terms of this being an issue of confidence, it is Parliament's job to scrutinize expenditures related to issues like the COVID-19 pandemic. And that's what this committee is being tasked to do, including with regard to the production of documents. I am very confident that we can manage this in a professional way. I am very confident about the motion itself. And I do firmly think that we should look at the results of the House vote this afternoon before examining this motion. I'd also like to talk about the supplementary estimates. This committee has not reviewed the supplementary estimates yet. So with that, given that there is a House vote this afternoon, I do move to adjourn debate on this motion.
Thank you, Ms. Rempel-Garner. The motion is to adjourn debate. It's not debatable. We will go now to the clerk to conduct the vote. Mr. Clerk, please go ahead.
Monsieur Thériault.
Mr. Thériault. I support the motion.
Mr. Barlow.
I support the motion.
Mr. D'Entremont.
Je suis pour la motion.
I'm in favor of the motion.
Mr. McGuire.
I support the motion.
Ms. Rempel-Garner.
I support the motion.
Mr. Fisher.
Every Liberal vote. No, sir. I do not support the motion.
Mr. Kellaway.
No.
Mr. Pawlowski.
No.
Ms. Sidhu.
No.
Mr. Van Bynen.
No.
Mr. Davies.
I'm sorry, could you read the motion again? There was my sound blacked out when I was going in between my headset.
The motion is to adjourn debate on Dr. Pawlowski's motion.
Oh, yes.
Mr. Chair, 6 yeas, 5 nays.
Thank you all. The motion carries. The debate on Dr. Pawlowski's motion is adjourned.
I still have the floor, right, Chair?
Yes.
Thank you, Mr. Chair. I move that, pursuant to the order of reference on October 22nd, 2020, the Minister of Health appear before the committee for no fewer than 2 hours to consider the supplementary estimates B on or before Friday, October 30th, 2020, and that this meeting be televised. So my rationale for moving this motion is as follows. We haven't been able to scrutinize government expenditures in some time. This committee, should the COVID motion pass, will be tasked with this issue as well as the very important PMPRB study. I think it would behoove the committee to have the minister appear on supplementary estimates this week prior to us undertaking those issues, since we've got a little bit of time between now and when the House motion, should it pass, kicks in. So this would also give committee members the opportunity to review some of the minister's responses to the supplementary estimates as part of planning the work plan for the COVID-19 study. So we've got some time this week. The minister hasn't been before committee in some time now. I think it would be a very productive use of our time to scrutinize the SUP-Bs, and we should certainly reach out to her and invite her to appear before the end of the week. Thank you.
Thank you, Ms. Rempel-Garner. Would you please send the text of your motion to the clerk?
Yes, I will do that right now.
Okay, we go now to, on Ms. Rempel-Garner's motion, we go now to Mr. McGuire.
Yes, thank you, Mr. Chair. I feel that this is just a common motion that we need to have. It's just for information's sake, and I'll just say that I'm in favor of it.
Thank you, Ms. McGuire. Mr. Davies, please.
I'm sorry, Mr. Chair, my hand is up to move a motion, so not for debate.
Okay, thank you. Ms. Sidhu, go ahead.
Mr. Chair, I would like to introduce my motion that pursuant to Standing Order 108 to the committee undertake a study on the impacts of the COVID-19 pandemic on Canadian long-term care facilities and the role that the federal government can play in supporting provincial and territorial partners whose jurisdiction these facilities are, that the committee report to finding and recommendations to the House, and that pursuant to Standing Order 109, the committee requests that the government table a comprehensive response to the report.
Thank you, Mr. Dew. However, the motion is not in order at this time. There is a motion being debated on the floor.
Mr. Chair, can I amend the motion? Not this week on the main estimate minister can come. Can I amend that motion?
If you wish to move an amendment on Ms. Rempel-Garner's motion, go ahead.
Yes. So this week, can we remove this week?
I'm not clear on what your amendment is.
So a minister to appear that I want to amend that motion.
Yeah, I'm not clear on exactly what amendment you're making.
So I just want to clarify, Mr. Chair, on that on main estimates. I think we need to. Can you clear on that? Like just
point of order, Chair. This isn't a motion on the main estimate.
So perhaps Ms. Rempel-Garner, if you've sent the motion to the clerk already, perhaps we can get a copy from him as we proceed.
So, Mr. Chair, I want to amend the motion to remove that the minister is to come this week on Ms. Rempel's motion.
Ms. Rempel, I too am not quite clear on the specific language of your motion, so I hope to see it imminently from the clerk.
Point of order, Chair. I did send it to the clerk, and it's a standard motion that every committee deals with, inviting the minister to appear on the supplementary estimates. And I would just, while I'm got the floor on the point of order to my colleague, it's standard practice for the committee to invite the minister on a certain time frame. It is up to the minister on whether or not she appears. So I think if we pass this motion, it's really up to the minister if she decides to come to committee or not. I know we can't compel her, but certainly you would think that the health minister would come appear before the supplementary estimates, the health committee. I just saying.
So I kind of missed that language in your motion. Did you say that you wanted the health minister to come this week?
I will read it again.
Please do.
Please do. Thank you.
That pursuant to the order of reference on October 22nd, 2020, the Minister of Health appear before the committee for no fewer than 2 hours to consider the supplementary estimates B on or before Friday, October 30th, 2020, and that this meeting be televised. This is pretty basic stuff, Mr. Chair. It's a motion to get the minister in front of the committee for subs. Thank you.
Thank you,
Mr. Speaker. Just a point of order on the level of sarcasm there. That's 4 days away. What Ms. Sadhu was asking, Mr. Chair, is if he could just remove on or before the 30th. The committee, I'm sure, will all agree that we want the minister to come, that we want it televised. Let's do it. We know these things. We always ask the minister to come. That's all Ms. Sadhu was asking for. There's no need to poke fun.
Thank you, Mr. Fisher. I should also point out that we don't have any meetings scheduled this week, and I'm not sure what the availability of time for that will be. We will have to check with the clerk to see if, and the whips, of course, to see if we can do that. Anyway, we shall carry on with Mr. Davies, please.
Sorry, I'm still waiting just to move my own motion. Thank you.
Okay.
But maybe we'll have the floor. I just have a bit of a question maybe to you, Mr. Chair. It had to do with your last comment that I know it's very difficult right now to figure out where we're going because we don't know the outcome of the vote tonight. And if we do, I believe there's a time requirement in the motion tonight to commence the study of COVID, which if it passes tonight, I believe would probably require us to commence the study a week from today. But I also think that my colleague, Mr. Emplegarner's motion to study the supplemental estimates and help the minister appear is also extremely valuable. She's quite right. We have not heard from the minister in quite a long time. And I think a lot of committee members have a lot of questions to ask her. But my question is, when you said we don't have a meeting scheduled, according to the rules, any 4 members of this committee could put in a motion at any time and require a meeting within 48 hours. I think that's is it a section 106, I believe, if I'm not mistaken. It's either 106 or 108. So the fact that we don't have a scheduled meeting this week doesn't mean that we could not schedule a meeting this week if we want to. And so I just wanted to clarify that there may be reasons for or against this with my colleagues, and Ms. Sadu may have some reasons why she wants to have more time. I respect that. But I want to be clear that if we do pass a motion today to hear from the minister on the supplementary estimates no later than this Friday, we absolutely can do that because the rules allow for that. So I just wanted you to clarify that.
Absolutely. I'm not. I'm just speaking in terms of what is availability of resources. So 106.4, Standing Order 106.4, based on a letter from 4 members of the committee, we have 5 days to call a meeting, and which requires 48 hours notice of that meeting. Absolutely, that could be done. However, it's a question of, do we have the resources available to us, the meeting resources for that? And that's all I'm addressing in that point of information. In any case, Mr. Davies, if you take your hand off, lower your hand, I will put you on the list for the first order of business after we resolve this.
Point of order, Mr. Chairman. I think there was a motion on the floor from Ms. Rumpel-Gardner, but didn't Sonia propose an amendment? Isn't there a motion to amend the motion? And are we not debating that now?
Yes, we are. And thank you for the clarification. So I believe Ms. Sadu moved to remove the time limitation, or the time, referencing this week specifically from the motion. And so that amendment is before the committee at this time. So Dr. Pulaski, did you wish to speak on that amendment, or?
Sure, I'll be very brief. It sounds like a good idea. It would seem very difficult to get the minister in the next, 4 days to appear before the committee. It would be hard to get the committee together. And undoubtedly, certain members of the committee will then point to the fact that we didn't have it as being yet another example of how the Minister of Health refused to appear before the committee. It wasn't a refusal. It was just technically getting it done in 4 days was really difficult. So I think we should drop that. And I agree with the amended version.
Mr. Van Bynen, please go ahead.
Thank you, Mr. Chair. I think it's quite reasonable and quite appropriate for the minister to appear before the committee to discuss these matters. I do not think it's reasonable that we require the minister to show up in 4 days. The minister is in the middle of a pandemic. Thank you very much. There are some priorities that we need to deal with, and the House is sitting as well. So I think there are a lot of things that need to be considered, and to require the minister to report in 4 days is just setting this up and being unrealistic. So while I fully support that the minister is there, and I don't anticipate there's going to be any difficulty in having her appear, it's the timelines that I find totally unrealistic and unfair to the minister, someone who has some very significant responsibilities as we're going through this pandemic. And I think that we should provide full consideration for that. These people are working 10 to 12, if not more, a day. And so I think we need to be able to accommodate our schedule to when they're available. So let's be realistic and let's be supportive at a time when people are working all out.
Thank you, Mr. Van Bynen. Mr. McGuire, please go ahead.
Thank you, Mr. Chair. I just think that for Mr. Van Bynen's very reasons, it's quite appropriate to have the minister appear this week. We are in the middle of a pandemic, and we've had a month now since Parliament was prorogued. I think it's just an opportunity to have the minister come in a timely fashion, have the discussions with her in regards to the estimates, supplementary estimates B, because then we're going to go right into the meetings for our own committee work subsequent to that. And rather than taking up meeting time in those areas, I think we could quite appropriately ask the minister to come this week. There's a lot of indications there that that the answers that might come up in supplementary that the minister might want to put forward in a presentation to us might actually help us in the deliberations that we would do in the subsequent weeks. So for that reason, I believe it's totally appropriate that they actually do come this week, and it's even more important because we are in a very right in the middle of a pandemic that's expanding, and so I just would vote in favor of it.
Thank you, Mr. McGuire. Monsieur Thériault, allez-y, s'il vous plaît.
Go ahead, Mr. Thériault. Thank you, Mr. Chairman. Very quickly, when the government introduced its supplementary estimates, it's not something that's unexpected. It's part of how we do things in Parliament. So there's nothing unexpected about it. When the government does so, the minister appears, and it doesn't take a huge amount of preparation. I think that the committee should be able to say what it wishes to do, and I could certainly understand that maybe in the circumstances the minister may have a valid reason to not appear. However, if we censor ourselves in our process and our objectives, I think that this is reasonable. 2 hours, I'm available, and we have certainly acted more quickly than that in other circumstances. For example, when we had the first wave of COVID, we had people back to back, one day to the next. We got these submissions often before the meeting, and no one said anything about that. We worked right through it. I think that the government is ready. The minister should be prepared. After all, the supplementary estimates have been introduced. We have this opportunity, and I think we should prepare for our subsequent work. If the minister cannot appear, well, that's the way it is. But I think that the minister is prepared. This doesn't take extraordinary preparation, and for that reason, I support the motion. If every time we make a decision here, if we have to ask the executive whether that suits them, I don't think that's reasonable.
Quick point of order, Mr. Chair. We are debating.
Go ahead, point of order.
We're debating the amendment of Ms. Sadu to remove on or before the week of October 30th, correct? It sounds like Mr. Thériault and Mr. McGuire were talking about the main motion, just clarifying.
Great, that is correct. Thank you. Ms. Sadu, go ahead, please.
Thank you, Mr. Chair. What I proposed are quite reasonable. We want the minister to come, but 4 days not is enough time. We are not asking minister don't come. It's for resources. And that's what I think it's quite reasonable. We want to, it's not like we don't want the minister don't have to come. It's about the resources. I think it's quite reasonable. And we have we want a minister, and we have until November 27th, and there are no resources, and we were happy to have her, but we proposed prior to November 27th, and we want, and it's not like we don't want a minister. We want a minister to come, but 4 days are not enough. It's not about the minister, it's about the resources. Thank you, Mr. Chair.
Thank you, Ms. Sadu. Mr. Fisher, go ahead, please.
Thank you again, Mr. Chair, we've heard about resources, we've heard about the committee can't compel, as Ms. Rimpel Gardner said, we can't compel her to come, but I suggest she probably will want to come, especially on an important topic like this. And I see that, notwithstanding, there's no heads nodding here, but I think everybody supports the idea of inviting the minister here. And again, I've sat on other committees before, and I don't remember a committee ever voting against inviting the minister. So I think I'll ask my colleague, Mr. Davies, have you ever had a motion, notwithstanding a 104, have you ever had a motion that just said, invite the minister and we want her in, not counting today, 3 days, in 3 days? Maybe that's happened. I've never seen it happen. I've seen ministers invited for everything, and there's always a time frame. I think that what we should just do is move on here, support the amendment and support the amended motion, invite the minister, and I would be very surprised if the minister didn't show up.
Thank you, Mr. Fisher. Mr. Kellaway, please go ahead.
Thanks, Mr. Chair. Yeah, I was going to comment on some of the things actually that Darren or MP Fisher brought up. Again, it's not a matter of not wanting the minister to come. I definitely, I think every parliamentarian and everyone on this Zoom call and anyone watching wants her to come, and I suspect that Mrs. Haidu, the Minister of Health, relishes that opportunity as well. I think we talked about some words today. I'm really big at, listening to some key words that have come up today around pragmatic and being calm. Those were some of the words I heard today, and I think one of them is around, the ability to look at this from a common sense approach and look at the fact that the Minister of Health is, like all of us, every parliamentarian and every Canadian, waging a battle against COVID. To give her 3 days to come here, I think we can do better than that. I think there's a common ground between this committee and the minister's staff to look at a time where she can come in, answer questions, and we go from there. So my hope is that we can look at this this amendment in the spirit that it is. It's a common sense approach to get to dialogue that we need to have with the Minister of Health for this federal government. Thank you.
Thank you, Mr. Kellaway. We go now to Monsieur D'Entremont. Go ahead.
Thank you very much, Mr. Chair. And what I'm finding concerning about making this amendment is that it really doesn't give any end date. It's we want to give the date by Friday. The Liberals are suggesting to keep it open-ended. And you know what, Mr. Chair? COVID-19 is growing in our communities. Maybe not here in Nova Scotia, but definitely in Quebec and Ontario, Saskatchewan. They've all had the highest numbers that they've seen in the last number of months, actually the highest numbers since COVID-19 finally came in. So if we think that Minister of Health is going to get less busy over the next number of weeks as she's trying to fix the problems created by this second wave of COVID-19, we're dreaming in Technicolor. I think she needs to come here as soon as possible because it's going to get busy for her over the next number of days. I can also tell you this: her estimates have been brought forward. If she doesn't know them and she's not ready for this, then why is she Minister of Health? Every Minister of Health needs to know what their estimates are, what they're bringing forward, and be able to debate it at the earliest convenience. If she can't be here by Friday, then maybe I would suggest to my colleagues to provide another date that makes more sense rather than leaving it open-ended, so that she doesn't come before November 27th. That it's just like, she got busy and she can't come before us. That's just my suggestion.
Point of order, Mr. Chair.
Thank you, Mr. D'Entremont. Go ahead, Ms. Sidhu.
It was not open-ended. The end date is November 27th. I proposed that already. Thank you.
No, you didn't. Point of order. The motion was to take away.
Ms. Rampel-Garner, please. Ms. Sidhu, thank you. But the motion, the amendment, as I understood it, was just simply to remove the time limit.
Mr. Chair, I said in my remarks till November 27th,
No,
And
she didn't, Mr. Chair.
Point of order, Mr. Chair. She did not. That was not her motion.
Can
Her
we
motion was-
not motion when I said my
excuse me,
statement.
everyone, wait till you're recognized, please. Mr. Du, I did not hear that. That is not the motion on the floor as I understand it. We can pass or fail this motion or this amendment. And if somebody wishes to move such a motion to amend it according to a specific date, that'll be different. But we'll have to go with that particular interpretation at this time. So Dr. Pulaski, you're up next, please.
Okay, so the argument now I think is about whether or not it's reasonable to ask the minister to appear within 4 days to address the committee. And in listening to this, I hark back to what Mr. Barlow threw out to me with this discussing the procurement of documents issue. And he said, Dr. Pulowski is a doctor. Wouldn't you, first of all, take the time to review everything that's happened in the past before you deal with this patient before you? And I like to you ask that question because I've got the answer to that. And the answer is an emergency room physician? No, that's not what you do. You don't, when you have an emergency right before you, you don't spend all your time on the computer looking at the past records for the past 5 years while the person dies in front of you. You have to, as an emergency room doctor, address the problems as they come up. This is really fundamental. And the same is true for healthcare in the ministries of health, the hospitals all across this country. They are busy. They're busy dealing with the second wave. And now I know the opposition doesn't think this is the case, that the Ministry of Health has all these people who are sitting around drinking coffee all day. And of course they can walk and chew gum at the same time. They can produce these documents. But you are, and yes, there's politics going on here, but I think you have to realize you are getting people who are really busy trying to fight this pandemic and making them do something else, making them dance to your tune. And you may be telling us, oh yeah, they can do it. But I would suggest—
Doctor, please address the chair.
Oh,
thank you.
Mr. Chair, I would suggest that the Minister of Health, like everyone else in the Ministry of Health, everyone else in the healthcare profession, are very busy trying to address this pandemic. And what you are asking them to do to get them dance to your tune and as quickly as you want them to dance is pulling them away from their essential jobs. And I would really question whether you're doing the country any favors.
So thank you, Dr. Pulaski. We go now to Mr. Davies.
Thank you. Well, I actually am hearing a lot of agreement, and you know, I'll just preface my comments by saying, you know, of course the minister's busy, of course the health officials are busy, so are we. But accountability to Parliament and to this health committee are not inconveniences. They are part and parcel of what we're elected to do. Canadians send us here to Parliament to either govern, if you're on the government side, and if you're in opposition, to hold the government to account. And you know, that's not accountability when it's convenient or when you're just not busy. It's accountability all the time. But I think there's a compromise here, and I'm going to move that we amend the motion to have the minister appear, if she can, on the supplemental B estimates before November 6th. That's 2 weeks. And again, as has been pointed out on all sides of this question, this doesn't compel the minister to come, but I think it gives the minister a reasonable opportunity. I think 2 weeks notice of an appearance before the health committee is a reasonable amount of time in the circumstances for her to come. And I would just also say that, you know, the pandemic argument is really a double-edged sword. You know, I've heard it argued that you know, we can't have the minister coming because she's just completely preoccupied and busy with you know, this pandemic, which is ravaging our country. On the other hand, I would argue that the seriousness with which this issue is affecting our country is all the more reason why we need to have accountability. So I don't know that any of us disagree with any of that, by the way. So to break the logjam, I would move that we amend the motion to invite the minister to appear by November 6th.
Thank you, Mr. Davies. I appreciate that. However, the amendment is out of order because we have Ms. Sadhu's amendment before us at this time. I would suggest
perhaps I can canvass Ms. Sadhu, Mr. Chair, and ask if she would consider that as a friendly amendment. She would amend her amendment herself. I don't know if that would be amenable to her.
May I speak, Mr. Chair?
Yes, go ahead.
Yes, Mr. Chair. If it's a sub-amendment, yes, that can be.
Yeah, we can't really do sub-amendments, but I can ask if it is unanimous consent of the committee to take Ms. Sadhu's motion to be amended as Mr. Davies has proposed. I think we can do that. Is there any? I'll ask for dissent on that change. Is anyone dissent to that particular amendment or to that particular change? Seeing no dissent, I believe that is the will of the committee the unanimous will of the committee to accept Mr. Davies' changes to Ms. Sadhu's motion. So Ms. Sadhu's motion now is that the minister be invited to appear on or before November 6th. Is that correct? Okay. So that is the amendment as it stands at this point. So we still have a number of people on the speakers list. So we go now to, so Mr. Davies, your hand is still up. Did you wish to carry on with your comments? No, you're done. Okay, Mr. Van Bynen, please go ahead.
I was going to suggest the same thing Mr. Davies did, so I'll take my hand down as well.
Thank you. Mr. Fisher, please go ahead.
No, I'm good now, Mr. Chair. I was going to suggest the same thing as well.
A lot of great minds thinking alike here. Mr. Kellaway, please go ahead.
Well, let me add to the chorus. I like where we ended up. Thank you very much. I'll take my hand down.
Well, it seems we have a burst of agreement. So seeing no further hands raised, I will call the vote on the amendment as most recently modified to have the minister appear before the 6th, to invite the minister to appear before the 6th. And I would ask the clerk to call a vote on that, please.
Monsieur Thériault.
Mr. Thériault. Mr. Thériault. I'm in favor of the motion.
Note that we're voting on the amendment, right? Go ahead, please.
Mr. Barlow.
I vote in favor of the motion.
Mr. D'Entremont.
I vote in favor of the motion.
Mr. McGuire.
I vote in favor of the motion.
Ms. Rempel-Garner.
In favor.
Mr. Fisher.
I'll support the amendment. Thank you.
Mr. Kellaway.
In favor.
Mr. Polowski.
In favor.
Ms. Sidhu.
In favor.
Mr. Van Bynen.
In favor.
Mr. Davies.
In favor.
So, Mr. Chair, 11 yeas and no nays, 0 nays.
Thank you very much, Mr. Clerk. So the amendment carries. So Ms. Sadhu's, Ms. Rempel-Garner's motion as amended is that we invite the minister to appear on or before the 6th, I believe it is, of November. Thank you all. So now the discussion carries on the motion as amended. So I see Mr. Van Bynen, your hand is up.
I'm sorry, Mr. Chair, I did not lower my hand from the previous discussion.
Okay. Okay, so I see no hands raised to speak on this motion as amended. So I therefore will call the vote. Mr. Clerk, if you would please.
Monsieur Thériault.
Je suis pour.
In favor.
Mr. Barlow,
I vote in favor of the motion.
Mr. D'Entremont,
Je suis en faveur de la motion.
In favor.
Vote in favor of the motion.
Miss Rempel Garner,
In favor.
Mr. Fisher,
I vote in favor, Mr. Chair.
Mr. Kellaway,
In favor.
Miss Sidhu. Sorry,
In
Mr.
favor.
Okay. Mr. Pawlowski,
Or
Mr. Van Bynen,
In favor.
Mr. Davies,
Yes.
Mr. Chair, we have 11 yeas, no nays.
Thank you very much. So that matter having been disposed of, I offered to Mr. Davies that he could have the floor to move his motion immediately following. However, Mr. Fisher's hand is up. Is that on a point of order? I would recognize you on a point of order.
Thank you, Mr. Chair. I would love to hear from Mr. Davies. I wanted to ask a question of the clerk and a little bit of a question of process. It can come at any time before the adjournment. Not a big deal. Thank you.
I should bring it to the attention of the committee that we are at the end of our allotted time, and ask if it is the will of the committee to carry on. Let us ask if there's any dissent for adjourning the meeting at this time.
Point of order, Chair. I'd let Mr. Davies speak to that.
Okay, fair enough.
Well, thank you, Mr. Chair. I wanted to move one of my motions about a potential study subject, but we're not going to have enough time to debate it. So I'm happy to move it now and then adjourn, provided that it's on the record, and then we can come back to it at some other time. If that's okay, I'll just read it into the record, and then perhaps we can adjourn the meeting.
Please go ahead.
Thank you. I'd like to move the motion for which I have served notice to my colleagues that, pursuant to Standing Order 1082, the committee undertake a study on the development of a national dental care program as an insured service for all Canadians, that the committee report its findings and recommendations to the House, and that, pursuant to Standing Order 109, the committee requests that the government table a comprehensive response to the report.
Thank you, Mr. Davies. And according to the discussion, I believe that the committee wishes to adjourn at this time. Is there any dissent from that? Seeing none, I will take up this matter certainly in our next motion. In our next meeting. Mr. Davies, you'll have to move to resume debate on the motion. I also I'm remiss. I should have mentioned relating to the study on PMPRB. I should ask all of the members to get lists of potential witnesses and potential contacts to reach out to for briefs to the clerk as soon as possible, so that he can issue the appropriate. Well, I guess for briefs, it's going to be by this Friday. I think he needs to make that request. And of course, we need to, at some point, take a look at the lists of witnesses, and we'll ask the analysts to maybe propose a work plan for us based on the lists we get them. So if we can get those lists of witnesses in as soon as possible, preferably by Wednesday, that would be great. And having said that, I do see Mr. Fisher and Mr. Dew have their hands raised. Is this are these points we've dealt with, or?
No, I was going to ask the clerk a point of clarification on something, but that can wait till next meeting, Mr. Chair.
Okay, thank you, Mr. Dew.
Mr. Chair, I know I just tabled my motion before when I shouldn't be. Sorry about that. I apologize. But I really want to table my motion and then after that we can adjourn if you allow, because it is very important to my residents. That's why I keep bringing my LTC motion. If committee's will is like that, I can table my motion today and then adjourn if
So strictly speaking, Mr. Davies' motion is still on the floor and still open for debate. So we can't, strictly speaking, move another motion at this time.
Point of order, Chair.
Go ahead.
I would just perhaps clarify to Ms. Sadu that she did technically attempt to move it. So it is in the, I would say that it is, her motion is in the public domain, correct? So I would then just say that she has tabled it, like she's tabled it, she's given notice of motion of it already. So her repeating it now would not actually do anything.
Thank you, Ms. Wempel-Garner. So seeing no more interventions, I will say the meeting is adjourned at this time. Thank you, everybody.